Parkinson's disease psychosis happens in patients with Parkinson's disease. Over the last few years, we have realized one of the biggest challenges in the treatment of Parkinson's disease has not only been the motor part, in other words, the tremor, the bradykinesia, the rigidity, but also some of the non-motor symptoms, and amongst them, one of the biggest one has been PD psychosis. So far, we do not have any FDA-approved medication for PD psychosis. Right now, when we talk about PD psychosis, we talk about a Parkinson's disease patient having a set of symptoms. They often feel like someone is in the room who may not be there. They may feel someone is looking over their shoulder when no one is there. They may actually have hallucinations, seeing things that are not there, hearing things that are not there, or they may have delusions, having false belief of things that are not there, that someone is trying to harm them, someone is talking about them. And when any of these symptoms occur in a patient who already has Parkinson's disease, that these symptoms have been present for at least a period of a month, there has not been any other cause for it. In other words, they were not started on medications, they didn't have any infections. Basically, the issue, the diagnosis of PD psychosis comes up. Once we diagnose a patient with PD psychosis, we know that the patient has progressed to a stage where we have a lot of other concerns that come up. We know patients with PD psychosis are much more likely to go to emergency rooms. We know they're much more likely to be admitted to the hospitals. They're much more likely to end up in a nursing home, and also much more likely to have a higher mortality rate compared to PD patients who do not have psychosis. It's kind of a cycle that begins, that more likely to go in the hospital, get to a nursing home, increase the risk of mortality in those patients. In addition, it also increases the caregiver burden, because often the patient may not tell the caregiver what they're seeing, they may not discuss with their physicians what is going on. Once they do mention to the caregiver is often not sure, is this something that's happening due to the disease, is it something different that's going on? Often when they complain about delusions or believing that the spouse may be having an affair or stealing from them, it increases more of a issue between this patient and the spouse. And these issues increase the caregiver burden and also cause increased depression and anxiety in the caregiver. So it's not only a disorder that's affecting the patient, but also the caregiver. So it is related to a number of factors, but we also know in general patients who end up in a nursing home have a higher mortality rate. So, but it's definitely not related to suicide. The patient with Parkinson's disease, we look at the number of reasons they can have psychosis. It can be due to the medications they're taking, whether it's Parkinson's medications or other medications that they may be taking, but a lot of it is related to the underlying disease process and a lot of neurotransmitters that are involved due to the Parkinson's disease itself. Normally in a patient who has psychosis, for example, a patient with schizophrenia, it is related to dopaminergic dysregulation. And what is happening in a patient with schizophrenia is you are trying to reduce the dopamine action to reduce the psychosis. The problem with Parkinson's patient is that they already have less dopamine in their brain. So using medications that are approved for schizophrenia in Parkinson's patients, you're going to worsen their Parkinson's symptoms because dopamine is responsible for the motor symptoms. So using those medications actually makes their motor symptoms worse. So that's a huge difference between a patient with PD psychosis versus a patient with schizophrenia, and we often cannot use similar medications in those patients. Of course, because we do not have any FDA medications approved for PD psychosis, we often end up using some of the similar medications in our patients. So like I mentioned earlier, until a few years ago, when we talked about treatment of Parkinson's disease, often it was focused on the motor aspects of the disease. It's only in the last few years we have realized that the patient's quality of life keeps getting worse, even though we were trying to maintain their motor symptoms. So people have looked at the other issues that are related to it. People have been using medications for schizophrenia, for PD psychosis, basically as an off-label use of these medications, in spite of them having dopaminergic issues related to it. So those dopamine blocking agents, even though they are worsening Parkinson's disease, we did not have any options related to it.